This is the Ear Science Podcast, the science of healthy hearing.
Hello and welcome to the Ear Science Podcast, the science of healthy hearing, proudly presented by Ear Science Institute Australia, a medical research institute. In this podcast, we'll bring you into our world, the world of ear and hearing science. Together with Dr. Shelly Chadha from World Health Organization, we are marking World Hearing Day and we'll be discussing the crisis in hearing health.
I'm Dan Vandermeer.
And I'm Lisa Kutsia, and we are your podcast hosts.
So Lise, we're back. This is season 2 of the Ear Science Podcast, the science of healthy hearing. The response to season 1 has been fantastic, and we have so much more to share with you.
Thank you so much, Dan. You're absolutely right. The response has been fantastic. In this episode, we are marking World Hearing Day for 2023, 3rd of March. I was fortunate enough to sit down with technical lead for ear and hearing health at World Health Organization, Dr. Shelly Chadha, to talk about the global crisis in hearing health and what World Health Organization is doing to help address the crisis. Shelly, thank you so much for joining us. What a privilege to talk to you today. The title of the episode is A Global Hearing Health Crisis. As the lead of ear and hearing health for World Health Organization, what is the state of hearing globally and what are you seeing?
Good morning, Lisa, and hello to all of the people who are watching this recording. So currently we estimate that there are about 1.5 billion people that have hearing loss, out of which about a third, so nearly 500,000, actually require some kind of ear and hearing care services. So it may be that they require a hearing aid, or maybe they require a surgery or some therapy or counseling, but they are in need of services. What's important also to note is that this need is increasing, and it is anticipated that by 2050, there could be over 700 million people that are in need of ear and hearing care. And while demographic factors, the whole world is aging, we are living longer, and thankfully, which is good, but it also means that people have hearing loss. More and more people have hearing loss. And also, so one factor is that, but then also the fact that there are many risk factors for hearing loss that are persisting and even on the rise. For example, listening to loud sounds over your headphones or earphones. So these are factors which are putting even more populations at risk. And this is likely to keep on increasing the number of people that have hearing loss in the future. So, of course, we have a huge problem, but the major issue is that the vast majority of these do not have access to services. Currently, the World Health Organization estimates that only about 17% of people that could benefit from ear and hearing care actually access and use these services. So the rest either do not have access or choose not to access them.
Yes.
So that is why it is a huge concern, and if you may call it so, a crisis.
Yeah, and Shelly, it's really that awareness piece has come through all the episodes of the podcast. It's people understanding that there is something that can be done and understanding that some of their difficulties are because of hearing loss.
Absolutely.
So, Shelly, the General Assembly for World Health Organization in 2017 passed the remarkable resolution on hearing. Can you tell us what the key takeaways of that was?
So, the World Health Organization has a General Assembly, as you said, which meets every year in May. And this consists of the ministers or secretaries of health of all of the 194 countries that are member states of the United Nations system. They meet and take certain decisions and discuss various issues of public health concern and importance. So this assembly in 2017 adopted a resolution on on prevention of hearing loss, of deafness and hearing loss. And this resolution, well, it has two main components. On one hand, it calls upon countries, upon the member states to to integrate ear and hearing care within child health, within health of older adults, to ensure access to screening services, technologies, rehabilitation, focuses also on preventative strategies. So that is one part of it. So really calling upon countries to act as part of their national health systems. And on the second hand, it also asks WHO, the World Health Organization, to undertake certain actions. So, these asks from the resolution are what frame the work of the WHO's technical program that I lead. So these asks are essentially to provide technical support to countries. That technical support comes in the form of advocacy initiatives like the Safe Listening Initiative, the World Hearing Day, which intend to raise awareness. But then also it is about providing technical resources, so evidence-based technical tools like the World Report on Hearing that can guide member states to take the right steps, actions to strengthen ear and hearing care within their health services and health systems. So those are the two aspects of this resolution.
That is such fantastic work that's been done, and the World Report on Hearing is such an amazing resource that's available globally to really make sure that there's a united approach to providing equitable access for hearing care. Can you tell us how World Health Organization is currently using the World Report on Hearing to focus its actions?
So the World Report on Hearing carries, if I could, summarize the message of its 250,
I know.
pages in one line, it is that integrated, people-centered ear and hearing care should be integrated into national health plans and services as part of achieving or as part of moving towards the goal of universal health coverage. So it is that this needs to be integrated across the life course and also across the continuum of care. So to implement this, the World Health Organization works closely with its country offices and with the ministries of health. So on one hand, we provide them also with the technical resources to actually implement the recommendations of the report. So these technical resources could be in the form of, let's say, standardized situation analysis tools or tools for monitoring, or what kind of indicators do you include, or how do you train health workers, or what are the things to put in place if you want to start screening. So providing that standardized guidance, but then also working closely with countries when they invite us or they request us. Then we work closely with countries to ensure that these recommendations can be realized based on the priorities of the country, but also based on experiences gained from different parts of the world and different countries. So we work with them to, for example, set up their training programs or screening programs, or provide them with certain models of service delivery of hearing aids that could be implemented in resource-limited settings. So that is how we work with countries to implement the recommendations of the report.
Shelly, that's so amazing to take that report and actually provide the guidance on how to implement the report. We often get reports, but some countries, like you said, might not have the resources to actually be able to activate the initiatives that they need to. Shelly, if I come back to one of your first comments that you said, and this prevalence of hearing loss and how that's increasing both by an aging population plus some preventable factors like noise-induced hearing loss, what is the key focus for World Health Organization for the coming year?
Um, so the key focus for us in this year, and really the key message, it is kind of again um, resonating the message from the World Report on Hearing, and that is the message of integration. So integration of ear and hearing care into healthcare services, as I said, across the continuum of care, that is, starting from community clinics or primary health centers or whatever, health posts, right up to the tertiary or the hospital levels where specialized services are provided. So one of the main challenges is that currently, in majority of places, ear and hearing care is provided at a tertiary level, at the level of specialized hospitals or clinics where people can access specialists. But given the high prevalence of these conditions, given the fact that ear diseases and hearing problems are some of the most common problems that people encounter in the community that they need services for, whether it is pain in the ear, discharging ears, otitis media, or hearing loss. This does not serve populations very well because they often need to travel long distances to see the specialist, posing a huge burden on them. And then also the specialists, because they are few in number, it poses a huge burden on these specialists that they have to see each and every person that is in need of care. So what is important for us and what we are focusing on this year is really about integrating across the continuum of care. So there should be ear and hearing care, which is accessible to people at the primary level of care, at the secondary level of care, and at the tertiary level, and not just limited to the superstructures or ivory towers, if I may call them that. So that is our key message. And for this, we require to make an effort to ensure that these services are included as part of the routine services provided at these health centers through training of personnel, through making sure that equipment is available and they are capacitated, they have the capacity to provide these services.
I'm speaking to a GP as well at the moment and part of this podcast in how do we make hearing care part of general practice care? So it's even in developed countries like Australia, it's not standard of care for hearing to be considered when we go and see a doctor. And then we have the increased difficulty when you go to communities where there aren't specialists or there aren't GPs to provide that care, or audiologists and ENTs. So we have to empower people, at the local community. And that's really something that the Institute is really working hard on, to see how we can empower local people to be able to provide care for their people. And it's not that reliance on audiologists, on ENT specialists to look after hearing loss and ear disease.
Absolutely. That is the message, Lindsay.
So that's fantastic that we really align. And that sort of really brings me to my next question. Ear Science is so proud to be a designated WHO collaborating centre for ear and hearing care in the West Pacific region. Can you tell the listeners actually what that means and why it's so important to have a designated centre in the West Pacific?
Thank you, Elisa, for that question. So, the World Health Organization has limited technical resources. It has small programs. And in order to achieve its mission, really to provide care across the world, it works with partners across the world. They include various civil society partners, organizations, big and small, development organizations, but also very importantly, academic and research institutes that form the kind of the backbone of the work that we do, because all of the work that we do must be evidence-based to make sure that We can have policies that are both, based in evidence and experience, and can then be implemented in countries reliably. So we work a lot with academic institutes, and these are our collaborating centers that collaborate closely with us and help us to develop that body of evidence to really provide us in a way with guidance, but then also work with us to test various tools and resources to gather data and information, collate them, package them in a way that can be digested by people across the world. So we have different collaborating centers. WHO has a huge network of collaborating centers. And in the field of ear and hearing care, we have about 9 collaborating centers, of which the Ear Sciences Institute is one. Thank you very much for all the work that you do on behalf of the World Health Organization.
Thank you, Shelly. We're very proud to be a collaborating centre.
But to answer the second part of your question, why is it important in this region? So the Western Pacific region of the WHO, to which Australia belongs, is actually the region which has the highest number of people with hearing loss. So you remember I mentioned about 1.5 billion with hearing loss. Actually, about a third of them are in the Western Pacific region. And it is anticipated that by 2050, we would have about over 750 million people with hearing loss in this region. So you have a lot of work to do.
Yes, it really is a lot of work, and we really take that work very seriously, Shelly. And everything we do is informed by research, and we have that sort of privilege of bringing together the clinical service delivery and the research. And so we have a lot of people committed to making sure that we reduce the prevalence of hearing loss, of the causes that, can be preventable, and then be able to treat people with hearing loss in the area. So, Shelly, this episode will mark World Hearing Day for 2023. What would you like to say to our listeners?
Thank you for a chance to speak to the listeners. And what I want to say is not a unique message, but simply to say that, the World Health Organization has the capacity to develop evidence-based tools and resources, but we need the partnership, the help of everybody, all stakeholders in the field of ear and hearing care to get the messages out, to get these messages to all sections of the community, to policymakers, to other health professionals, to people living in communities. And we really ask your help, your support, of all of the listeners and viewers of this podcast to join us in this effort. So we all have the power to raise awareness. It doesn't matter if that we can do that in a group of, let's say, 4 students, or we can reach 400,000 or 4 million people through podcasts and things like that. But it's important to keep doing that. So my key message would be, please join hands with us on this World Hearing Day. Make sure you do some activity that will raise awareness about hearing care, about hearing loss, the importance of hearing, prevention of hearing loss, importance of hearing care within a section of the society. That would be my message.
That is a great message. Thank you so much, Dr. Chadha, for being part of the Science of Healthy Hearing podcast.
It was my pleasure, Lisa. Thank you.
Thank you.
We are so grateful for Dr. Chadha sharing her insight into the state of hearing globally, and we thank her for all the work she and her colleagues at the World Health Organization are doing to help address this. Next up in Series 2 is Hidden Hearing Loss with Dr. David Sly. We acknowledge the traditional custodians of the land that we are recording this podcast on, the Whadjuk people of the Noongar Nation, and the land on which you're listening from. We pay respects to Aboriginal elders past, present and emerging. If you've enjoyed this episode, let us know by rating and reviewing this podcast or sharing it with a friend or family member. Make sure you're subscribed so you won't miss an episode. To view this episode as a video with captions, visit the Ear Science YouTube channel or our website www.earscience.org.au/podcast. You can also visit our website to suggest a topic for a future episode, for links to more information and all the research papers on this topic that we have discussed today. This podcast provides information of a general nature and does not constitute medical advice. The producer of the Ear Science podcast, The Science of Healthy Hearing, is Emma Ireland, with sound engineering and editing by myself, Dan Vandermeer.